Amanda, and today I'm going to be performing my CVA blood draw from the port. So before I begin, I'm going to just read my MD order. So this is the MD order, and it's for Mrs. Mary Peep, and she requires a blood draw specimen, and that is stat, so I'm going to do that. Put that down. Next, I'm going to prepare my supplies needed for the blood draw. So here's my tray of supplies, which includes a 10 milliliter filled syringe of normal saline, 2 empty sterile 10 milliliter syringes, some clean gloves, alcohol prep pads, a 4x5 transparent dressing, and a new injection cap. So I'm going to just set my supplies right here. And also want to mention, here's my biohazard bin and hand sanitizer for hand washing. So now you can begin. Hello, may I come in? Perfect, so I'm going to hand wash. My name is Amanda and I'm going to be your nurse today, okay? So could you please tell me your first and last name and date of birth? Okay, great, thank you, Mrs. Peep. And Mrs. Peep, do you have any allergies I should be aware about? No allergies? Okay, that's great to hear. So Mrs. Peep, the reason why I'm in here today is because your doctor ordered me to just get a blood draw from your access port, okay? Is that all right with you? Okay, great. It shouldn't hurt, and this procedure is fairly quick, but anytime you feel any discomfort, just let me know, okay? Okay, great. So I'm gonna adjust the bed, make sure it's proper body mechanics, and now we're going to begin. So I'm just going to wash my hands again and don clean gloves. I'm gonna don gloves. Okay. Okay, Mrs. Peep, is it okay if I remove your sheets so I can access your port? Okay, great, thank you. So we're gonna pull down her covers, her sheets, and here's her port, her access port. So before I remove the bandage, the old dressing, I just want to assess the site, and I don't see any redness or swelling or signs of inflammation, so that's good. Okay, so now I'm going to carefully remove the bandage. And I'm going to remove and put this in the biohazard bin right here. Okay, so that looks good. So I'm going to now make sure the line is clamped. So I'm going to clamp the line and also make sure that any IV infusions are put on pause while this is performed. So I'm going to turn off any infusions and again clamp the line. So next I'm going to get a alcohol prep pad, and I'm going to clean the injection port for 20 seconds, and I'm going to allow that to air dry. So once that is done air drying, I'm now going to get one empty 10 milliliter syringe, and I'm going to attach it to the line. And now I'm going to unclamp the line once again to withdraw 5 milliliters of blood. So carefully do this. Okay, so before I remove the syringe from the line, I'm going to clamp it again. Now I can remove the line, or remove the syringe and cap this, and I'm going to discard this. Okay, so next I'm going to now collect our specimen of blood. So I'm going to grab the other empty syringe, and I'm going to clamp it to the line, to the access port, I'm sorry. Now unclamp the line again and carefully collect our specimen of blood. So I'm gonna collect 5 milliliters of blood. Okay, and I'm going to clamp the line. So I clamped the line, and now I'm going to save this as this is our specimen of blood. So I'm gonna just save it right here, and that will go to the lab. So now I want to grab the normal saline that is already filled, and I'm going to grab the new injection cap. So I'm going to grab that, and I'm going to attach it to the syringe of normal saline, and I'm going to just quickly prime it. So I primed the cap, and I'm going to set this down for a minute. And I'm going to go back to here and make sure the line is clamped, and I'm going to remove the old injection port from the line. So I'm going to remove that and throw it away. Now I could grab the new injection cap that is attached to the saline syringe and attach that to the line, like so, and unclamp the line once again, and carefully in a pulsating motion, I'm going to flush the line of the remaining cc's. So I'm just doing pulsing. Okay, so that is flushed. Now I'm going to clamp the line, remove the syringe, toss that, and I'm going to make sure it's placed properly on the patient, and just because I want to make sure everything's clean, I'm going to grab an alcohol prep pad and just clean this side again. Allow it to air dry, and once it's already air dried, I'm going to apply the new transparent dressing to the access port. So I'm going to put that there. So I applied my dressing, and I would just initial time and date, and put the covers back on her, remove my dirty gloves, and wash my hands. Okay, Mrs. Peep, I'm all done with drawing blood from your port. Do you feel okay? Okay, that's good to hear. So, Mrs. Peep, now that I'm all done, I'm going to leave you with your call light, and to make sure that you are comfortable. Are you okay like this? Okay, put the bed railings up for safety. All right, Mrs. Peep, we're all done. Like I said, I'm gonna now just go document, and I'll be back to check up on you in 15 minutes, okay? All right, sounds good. Thank you. Now I'm gonna just take all my supplies and make sure that I dispose of this properly. And that's it.